Do you know how Medicare works with different company sizes as far as do you have to sign up for it or not?
Most people don't realize that the answer is some people do have to sign up at 65 and some people don't. So we are going to tell you why and tell you a little bit about how it works when your company pays for your healthcare, but then you turn 65. We're Shannon and Michael. We are with Healthcare Genius and we're always here to help.
Yeah, Shannon, so we did a video on a case study with one of our clients who had less than 20 employees. And it was really eye-opening to see what her costs were going to be. There's kind of a misconception out there that, and you get this in materials, you'll see people, about 3 months before you turn 65, you'll start getting inundated with packets. A lot of the materials are going to tell you you've got to sign up for Medicare, otherwise you're going to be penalized, which isn't necessarily true.
No. First, let's talk about when it is true. It is true when you don't have any kind of group coverage. So let's say you have an individual plan, maybe it's with your family, but your employer is not offering you any kind of health benefits, so you have to do something different. In that case, when you turn 65, whatever plan you're on, you have to get off, you have to sign up for Medicare.
That's right. COBRA, another example. If you retired early and maybe you took COBRA coverage from your company and now you're turning 65, that's going to end when you turn 65.
That's right.
So you'll have to go on to Medicare Part A and B. But what's the other situation where if you work for a company that you have to do that, Shannon?
That situation is if you work for a small company, and when we say a small company, we mean under 20 employees generally. If you work for a company that has less than 20 employees, unfortunately, you won't have a choice. So even if you work until you're 85 years old, the day you turn 65, if you're working for that small company, you have to get on Medicare.
Another thing that happens when you look at Medicare is a lot of times people will tell you, well, sign up for Part A because it's free. It doesn't hurt you. But it can hurt you. So we'll give you an example of that. When you work for a company over 20 employees, the rules basically say you do not have to sign up for Medicare as long as you're still working. In addition, if you have a spouse on your plan, they don't have to sign up for Medicare, so they can stay off. Now, the exception to Part A is that if you or your spouse are receiving Social Security benefits, they do require you to sign up for Part A. Yep. But why this is really important is we've seen this increase in high deductible health plans with health savings accounts. And once you're on a Medicare Part A or B, you no longer qualify for a contribution into a health savings account. So keep that in mind, especially if you're, again, working for a larger company over 20 employees, that if somebody tells you sign up for Part A, you may not want to do that.
Yeah, and as we've talked about in a lot of our videos, HSAs are like a triple whammy. I guess that's not really a term, but they're the most tax-advantaged way to pay for healthcare costs later on. You want to contribute to your HSA as long as you possibly can, so that might be a reason why you don't take Medicare Part A right away.
We have a client where they pay basically 90% of the HSA contribution for an employee. So in that case, if somebody had signed up for A, they no longer get that contribution.
Yep.
So they're giving up free money from the employer. These are really key points to understand, and we keep telling people need to understand these early.
Yep.
It's why we have designed our healthcare money plan to take all of these different factors into account.
Yeah, definitely. And there are a couple of other things that you should be thinking about. The HSA is one really good reason why it may not be, even if you do have the option, may not be best to go on Medicare right away. The second, and maybe what we see as the most obvious, but that is missed by a ton of people, is Medicare may be way more expensive than what you're paying for your group plan. For a lot of people hearing that, they're like, what? What do you mean? I thought Medicare would save me money. And that's not always the case.
No, and for the business owners or key executives where they're higher income earners, they have to pay a much higher cost for Medicare. So in a lot of those cases, it completely doesn't make any sense to sign up for for Medicare. So we wanted to kind of give you this idea. One other thing that we offer is we do have we call it our crystal ball. It will help you forecast what healthcare costs are going to be look like in retirement. There's a lot of numbers out there. Fidelity has a survey every year that they put out. It's about 285,000, I think, last time we saw it. But for a lot of people, those costs are going to be a lot higher. Our crystal ball, when you take the quiz that's down below in the comments section, will give you an estimate of what those costs are going to look like. It's also going to show how it will impact your Social Security down the road.
Yep, and this is something that we do for free for everybody. Our number one goal is to educate people, as many people as we possibly can, about healthcare costs in retirement. We want you to know what you should expect. It's going to be a little different for everybody, but there is a way to figure it out, and that's by checking out our crystal ball. So again, we're Shannon and Michael. We're with Healthcare Genius. Go ahead and check out that crystal ball in the description down below. If you haven't already, subscribe to our channel and click the notification bell so you know when we come out with new videos. And if you have any questions on going from an employer plan to getting on Medicare or anything surrounding that topic or anything else healthcare and retirement, feel free to let us know in the comments below.